Hello, and welcome to the first WellPoints Rewards Wellness class of the 2021-2022 plan year. My name is Mike Dodd. I am one of the benefits advisors that works with the city on your health insurance benefits. And we're here today to talk to you about how you can get the most from your health insurance plan. And I know that sounds a little boring and it's not the most exciting topic, but there are some really important things to kind of keep in mind. And we all kind of know we have health insurance. We know that we have a deductible. We know that we have copays. We know the city has an HRA. But sometimes we don't think about how to kind of maximize our dollars inside the health insurance plan by choosing the right location to get services, using various services that are built in either by the city or Cigna. So we're here to kind of talk to you about that today. So today we're going to talk about how you determine what care you need. Once you know that, where do you go to get that care? We're going to remind you about Teledoc. Teledoc is a great service that the city is providing for you, and it will save you a lot of time and a lot of money in a lot of situations. And then also, we're going to talk about some of Cigna's programs that are built into your health insurance plan. Always, if you have questions about these as we go through them after this session, contact our office. Again, it's W.E. Shaw and Associates. Personnel will be able to let you know how to get in touch with us. I'm happy to walk through these programs with you. We can put you in touch with people at Cigna if needed. So we're here to help you with these things. So the first thing I mentioned was determining what you need. And I know that sounds very basic, but do you need routine care? Something can be handled at the doctor's office. Do you need to step up and go to urgent care? That's something that cannot wait, but it's not life-threatening. Or do you truly need emergency care? That is a sudden, serious health condition. Asking yourself that question first will help you. I know a lot of times things get chaotic and we immediately say, I've got to go to the emergency room. And a lot, maybe you do. But very often people go to the emergency room, incur emergency room cost when they could have gone to an urgent care facility. Sometimes they could have even gone to their doctor's office. Time of day is important. If it's a weekend and your doctor's not open, urgent care is likely open. We'll talk later. Teledoc, if it's a more routine thing, Teledoc is open 24/7. So keeping those in mind and knowing where to go and when can save you money, save you time. So I guess the first question is, what is an emergency? And that sounds, like a very simple question, but like I mentioned, sometimes we have things happen and we don't know what to do. So we run off to the emergency room. And in medical, the emergency room might be the most expensive place to get something done. So while you have a copay, you are going to pay a higher copay for an emergency room visit, and the plan's going to incur a lot of expense if you go to the emergency room. If you have an emergency, go. Don't pause, go straight to the emergency room. But if you have something to be handled somewhere else, you will save money, the plan will save money, which translates back to better plans and lower rates down the road for you guys. So what is an emergency? Obviously it's a life-threatening issue that requires immediate care. For these type of issues, you are going to call 911. They're that serious. We need to use emergency treatment. If it is something that you drive yourself for, I've had a kidney stone in the past and did not know what it was. So we went straight to the emergency room because it was the middle of the night and the pain was significant. We called ahead. We let them know we were on our way so they could know we were on the way. Medical staff there, sometimes if it is a significant issue, they can be waiting for you. Also, it's always good to make sure you have your insurance cards, a list of medication, and your health history, because the doctors there are going to need to know that. Frequently, when you visit an emergency room, they don't know you, so they don't know your medical history. So keep those things in a convenient place, such as your purse, your wallet. Additionally, your smartphone is going to have an app on there to keep this information. And we'll talk in a little bit about the app that is tied to Teladoc. It's called My Benefits Work. My Benefits Work has a digital wallet built in where you can snap a picture of your ID cards, your medical, your dental card, your Teladoc card, your immunization records, all of those things, a list of your medicine, and keep it all in one app. So we encourage you to put that information somewhere so that you're not caught off guard when you need it. We all know what emergencies are, but here are a few examples of emergencies. If someone is not breathing or having a great difficulty breathing, choking, and you can't, try the Heimlich maneuver, you cannot get that item out. Heart attack, stroke, these are things you're calling for help for an ambulance. Broken bones, severe bleeding, severe burns, someone's in shock. Those are items that we're going to pick up the phone, call 911, or get ourselves to an immediate emergency room. In a true emergency, we want to remind you that you can use the closest hospital facility regardless of the network that you participate in. So the city offers two health insurance networks, the Open Access and the Local Plus network. Plan 3 is on the Local Plus network. Local Plus does not include HCA TriStar hospitals or Sumner Regional. So our closest in-network hospitals are St. Thomas, Vanderbilt, those type places. However, in a true emergency, if you are around the corner from Hendersonville Medical and someone has a heart attack, get to Hendersonville Medical. Your plan is built so that you are able to access the closest hospital in an emergency. The way that works is if you visit, in my example, Hendersonville Hospital, they are going to treat you. Once you are stable, if you have to be admitted to the hospital, once you're stable, they're going to get you transferred to an in-network hospital. So just kind of keep that in mind. We don't want anyone to think that you don't have access to a close emergency room. The city is very conscious of making sure that the plans are built in such a way that no one is going to have to seek out medical care or they're going to have to travel a long way for that medical care. So if you don't have an emergency situation, but you have an urgent care situation, there's a different place to go. It's cheaper, more affordable. Sometimes it's a lot easier to access. So what are those kind of urgent care situations? Those are going to be things like sprains. You have an acute pain that just won't go away. It's not a life-threatening pain, but it just won't go away. Serious cuts, burns that are smaller burns, 2-3 inch diameter type burns. This mentions frostbite. I don't think we have a whole lot of frostbite in Middle Tennessee, but we all know we get cold sometimes, so it could happen. Reminder, urgent care, these are facilities that are specific standalone facilities that are there for handling those type of issues. Some examples inside Hendersonville: Crossroads, Care Now, American Family Care, Complete Health Partners. There are several urgent care facilities that you can access. As a reminder, urgent care is going to be subject to your network. So if you're in Plan 3, the Local Plus plan, make sure that the facility is in your network before you use them. But urgent care is not an immediate life-threatening issue. So you would be able to take an extra minute and figure that out. I'm going to talk to you in a little bit about a service that Cigna has that will also help you in that situation. So make sure that they are in your network. One other thing to point out on urgent care is how they bill. Some urgent care facilities bill themselves as an emergency room. So an urgent care facility that bills itself as an emergency room, you're going to pay the ER copay. However, it still should be easier to access than the emergency room, especially as we record this in late August. Emergency rooms are taxed right now, and it is really hard to get in. COVID, the Delta variant surge has really pushed our hospitals and our ER facilities. So if you have one of these items that you could handle at emergency room, even if you had to pay an ER copay, it's going to be better to use urgent care. However, more often than not, urgent care facilities built as an urgent care. So you're going to have a lower cost for using that urgent care facility and the convenience. So that's important. There's also a kind of a subset of urgent care. Cigna calls them convenience care clinics. Some people refer to them as walk-in clinics. So a convenience care clinic is going to be somewhere like the little clinic at Kroger, the Vanderbilt, I believe they used to be called Minute Clinics, but the Vanderbilt clinics at Walgreens or the Vanderbilt walk-in clinics. These are facilities that are not truly urgent care facilities as far as contracting, but they can provide a lot of the same services. And so Vanderbilt has built a walk-in facility in Hendersonville. In addition, we have, like I said, Kroger, CVS, all of these places have these walk-in clinics. More often than not, those are going to be billed even lower than urgent care. They're going to be billed like a doctor's visit. So if you don't have something that you need to go to true urgent care for, and you can walk in at a Vanderbilt clinic or walk in Kroger, that's something to consider. They're going to have more expanded hours than your doctor's office and let you access that care again, easier and cheaper. So as we keep talking about this, it's all about, as I said, knowing where to go and what is the most affordable way and best way to get the care you need. And then kind of the next step down is routine care. Routine care are going to be things that either you can treat at home or through a doctor's appointment. Minor cuts and sprains. If you have a fever, somewhere between 100 and 102, obviously right now with COVID, if you're running 102 fever, you probably need to go get tested. But, once we get through COVID, you probably are just, you're dealing with a flu or something. You can deal with that at home. You don't need to go to the ER. You don't need to go to urgent care for that. You've got a bad headache, you've got sore throat, respiratory infections, just kind of the normal back and neck pain. Those are things that you can make an appointment with your doctor or treat it at home, use a convenience care clinic, or use telemedicine. And telemedicine is the teledoc service that the city provides for you. So what is telemedicine? Many of you have already used this service, but for those of you who haven't, what is it? Telemedicine uses technology and allows you to communicate with a doctor without being in the same place. Obviously, over the last 18 months since COVID began, telemedicine has become very, very important. In the early days of telemedicine, or early days of COVID, I'm sorry, a lot of doctors only would see people through telemedicine. So we're much more familiar with telemedicine today than we were 18 months ago. The city has been well ahead of that curve and provided this service for you for a few years now. It's not a complete replacement for in-person doctor visit, but it can be useful a lot of times. So how does it work? You will speak with a doctor by telephone or video call. You discuss your medical issues. The doctor can then see you or talk to you, assess your symptoms, discuss your medical history with you, and then they provide initial diagnosis. If you need a prescription, they call a prescription in. So, a couple of examples of how that can work. A lot of times we know what's wrong with us medically. We know that I've got bronchitis, I've got a cold, I've got this. My child gets strep throat all the time and it's happened again. We know those things. So we make an appointment with the doctor, we go to the doctor confirms it, gets us a medication. Well, what telemedicine does is it lets us access that doctor quicker, easier, talk to them about that. Usually a telemedicine call is not a very long call. It's what's going on, what's your history, let me get you a basic course of treatment and take care of that. I personally get bronchitis. It feels like once a year. My wife works with children, brings home all kinds of good stuff, and I get sick. I can pick up the phone, talk to a telemedicine doctor. Hey, doc, I've got bronchitis again. What are your symptoms? I go through that. And the doctor says, yep, that's what it sounds like. Let me get you a cough medicine. Let me get you an inhaler or whatever you need. And they prescribe that, and I'm off and running. I didn't have to take the time to talk to the doctor in a office setting. I didn't have to make an appointment. I didn't have to wait in a waiting room, which right now is probably not a great thing. And then I'm able to kind of deal with that. You can deal with it on the weekend. You can deal with it at night. You can deal with it while you're traveling. So, that's one example of how teledoc can work. You could have something that's a little quicker developing. I have a client that was holding a cat and the cat scratched him, and that scratch kind of swelled up a little bit. So he was able to, through telemedicine, take a picture of that scratch, send it off to a telemedicine doctor. The doctor said, yeah, it probably is infected. Let me get you an antibiotic. This was on a Friday night, so it did not get worse. And then he was able to deal with it. So those are the type of situations that you can use telemedicine. So what kind of illnesses can be addressed through telemedicine? Again, we're talking about non-emergency things. If you have an emergency, get to an emergency room. But we're talking about that next step down. Colds, flus, sinus infections, allergies, pink eye, stomach aches. I have people who've used it for UTIs. I have personally, and I know people who've used it for medicine refills. So let's say you're traveling and you forgot to bring a medicine with you. You can contact that telemedicine doctor and they can get you a short-term refill. So it's things like that. We're talking about the non-emergency situations, the more routine things that you can handle quickly. So that's what telemedicine is. If you participate in any of the city's health insurance plans, you have teledoc. Okay. Teledoc will let you access a doctor 24/7, 365 days a year. There is no copay to speak with a doctor through teledoc. So what you will do is you will speak with a doctor that's licensed in the state from which you call. If you are sitting in Hendersonville and you call, you're going to speak to a Tennessee licensed doctor. If you're on the beach in Florida and you have a sick child, you're going to speak to a Florida licensed doctor. And I mentioned your child. Your entire family can use teledoc regardless of whether they're on your health insurance plan or not. So your spouse and your children all have access regardless of whether they're covered. The city has purchased a family teledoc plan for each person. So that's a great benefit that lets you talk to a doctor for a sick child, regardless of whether he or she is on your health insurance plan. Almost every health insurance plan now includes a telemedicine feature. However, the vast majority, or almost all of them, have a cost associated. The city's commitment to you by purchasing the teledoc plan we use is that you will have no copay. So teledoc is around the clock and it is free. And the important thing to remember there with teledoc is, on average, a doctor is going to return your call in about 10 minutes. So if you are sitting around at 4 o'clock in the afternoon and not feeling well, either call teledoc or hit the button on your My Benefits Work app. You're probably going to be talking to a doctor in about 10 minutes. I've seen it happen within a minute or two. I've also seen it take a lot longer. My wife used it on Christmas Eve one time and it took a while. You almost have to think of teledoc as like Uber for doctors. Their response time is going to be faster based on the number of doctors taking calls. So on Christmas Eve, not many doctors are taking calls. It took longer, but the average is 10 minutes. And I think I've only waited more than 10 minutes one time. So teledoc is quick, convenient, and cheap. If the doctor prescribes a medication for you, you will pay for that medication, but that's all you pay for that whole encounter. So the teledoc service, here's a quick example from teledoc of how a family uses it.
Meet Jessie. Like every parent, she wants what's best for her family. Malia and Aiden mean the world to her. Of course, just like every parent, Jessie is busy, which is why teledoc works so well for her. Teledoc gives her peace of mind because Jessie knows her family can get sick anytime. It's never convenient. But whenever she needs our care, she can always reach a doctor or pediatrician within minutes. No expensive late night trip to urgent care or the ER.
Hi, Malia. I'm Dr. Potter. How are you feeling tonight?
Not so good.
I'll send over a prescription right away.
Thank you, Dr. Potter.
Thank you, Dr. Potter.
When medically necessary, a prescription can even be sent to the pharmacy of your choice, which helps everyone sleep better at night.
So how do you access Teladoc? Again, as I mentioned, every person who's enrolled in a city health plan has access to it. The easiest ways are either use the My Benefits Work app, and you can kind of see a screenshot of what that app looks like. Or go to mybenefitswork.com. If you call, the phone number to call is 855 VIP Docs. In the past, you could call pretty much any number and get through to the right place in Teladoc. But with the explosion of telemedicine during COVID, they've had to make sure that you're calling in the right way. You should have received a card when you first signed up for health insurance or when Teladoc was added a few years ago. That card also has these numbers on it. If you need access to that card, if you will email HR or email our office at info@weshaw.com, let us know your name. We'll get you a copy of your card. When you register, you'll have an ID number. Once you access that ID number, you will be able to put the My Benefits Work app on your phone. And you see there the little third tile says Teladoc. All you do is click that and you're into Teladoc requesting a doctor. So very easy service. And I mentioned that wallet. You can kind of see the icon there at the bottom, the kind of third icon in teal. That is your wallet. So you can also take pictures of your ID cards to always have them with you on your phone. So great service, great app. One thing to remember, you will have to re-register your dependents on an annual basis. It's a weird quirk of Teladoc. They make you re-register dependents. You should not have to re-register, but you do have to re-register yourself. And one thing that we always like to remind people, do this now, do this when you have time, because what will happen is if you are sick and you want to use Teladoc, but you have not registered, you'll have to go through the registration process, and then you'll have to answer some health questions. And just like you have to fill out the clipboard when you visit a doctor, you have to fill out the clipboard or answer the questions online in Teladoc's case when you register for Teladoc. So they need to know your height, your weight, do you smoke, do you drink, medical issues, drugs you take, because the doctor's prescribing drugs. So a doctor's using that health history to know what to and not to prescribe for you. Do you have any allergies? Those kind of things. So we recommend that you do that now. Don't wait till you need it because it will slow things down. And if you've just taken care of it, Teladoc is truly one button away for you. So, we've spent a good amount of time talking about where to go, when to go, how to go, all those kind of things. So Cigna actually has a very nice chart, and we will make sure that HR has a copy of this. But they kind of show on that chart the continuum, anything from what they call virtual care, that's Teladoc, to convenience care, to your doctor's office, to urgent care, all the way to the emergency room. What do you use Teladoc for? Like I said, use it for colds, flus, rashes, headaches, allergies, all those kind of things. If you need to go convenience care, maybe you have a little more that you want someone to see you in person. That's going to be your walk-in clinics, your doctor's office. Very important. We need you to go to the doctor's office for routine checkups, preventive care, vaccines, those kind of things. Urgent care, maybe things have gotten worse. You've got cuts, sprains, burns. Then you go to urgent care, and then ER. Like we said, those are chest pains. Those are sudden numbness, weakness, uncontrolled bleeding, all that kind of stuff. So this kind of continuum from green to red is something to remember and where to go. But in the moment, how do you figure that out? Cigna does have what they call the Cigna Health Information Line. And this line is a phone service. It's going to be staffed by clinicians, and they can help you understand and make informed decisions. They can help you choose the right care, the right setting, and the right time. So that service is available to every Cigna member. To contact them, there's a phone number on the back of your ID card, or you can go to mycigna.com or use the MyCigna app. And we haven't talked a lot about the MyCigna app. I know we have talked about it over the last several months since the transition to Cigna. It's important. If you will go ahead and register and put that app on your phone, there's a wealth of information there, including the health information line. So if it's not a true, I need to call 911 situation, and you're thinking, can I go to my doctor's office versus urgent care for this? Pick up the phone and call Cigna. Let them kind of help you. Let a clinician, a nurse practitioner, someone like that talk to you and say, yeah, you probably should go to urgent care for that. Or you know what, you're probably good doing a walk-in or doing telemedicine. So Cigna has that built in. Every one of you can access that anytime. So we've spent a good amount of time talking about knowing where to go, when to go, and how to go and get services. But there are several other programs that Cigna has built into your health insurance that you may or may not be aware of. And we want to get the most out of our health insurance benefits. And if they've built a program in and it fits your lifestyle, let's use it. So we're going to talk about a program called Active and Fit, Healthy Rewards, Cigna Lifestyle Management, and the Cigna One Guide. We'll talk about each of those. If you want more information on those, you can access those through mycigna.com or the MyCigna app. All the information is in there. So the first is Active and Fit. And several people used Blue Cross Blue Shield's gym membership program. The gym membership program through Blue Cross, I think, was $29 a month. Cigna uses a program called Active and Fit. It is $25 a month. Active and Fit is going to let you access 11,000 fitness centers nationwide, 2,500 digital workout videos. They're going to be facilities like Anytime Fitness and Planet Fitness and Gold's Gym. The digital videos, you got Jillian Michaels videos, you got some yoga videos, Zumba, all kinds of stuff is you can access through this program. The actual physical locations around Hendersonville, there are several. Gold's Gym, Planet Fitness, Absolute Wellness, Work Out Anytime. And Goodlettsville, you got All Time Fitness. You've got Just Be Fit in White House, Elite Fitness in White House, and the Gallatin Civic Center. So you have access to all of those for $25 a month. In addition, there are multiple Planet Fitnesses and Workout Anytimes, Gold's Gyms. I've just listed one. You're not limited to just the Hendersonville location. So there, it's a good idea of what is available. There is a premium membership available through Active and Fit that I believe you can access that will also pick up a couple other places, some Pilates places, bar, those kind of things. So great service inside the app. If you want to sign up for it, you'll have directions to get to the Active and Fit website, enter your information, sign up. It will likely save you money, or if you have a very cheap gym membership, it's going to give you a lot of choice of places to go. The second program is Healthy Rewards. And as it said, it is a discount program. Okay. So it's going to provide discounts on things like a nutritional meal delivery service, the fitness membership that we just talked about, in addition to some fitness devices. LASIK surgery. We get that question a lot. Is LASIK covered under vision insurance? And it's not. It's usually never covered under vision insurance by an employer, but Healthy Rewards is going to give you at least some discount there. Hearing aids, same thing. Hearing aids are not covered by health insurance, but here's a discount program for you. And then there's some alternative medicine things, things that are not traditional, whether it's, maybe something like acupuncture. There'll be some discounts there. yoga products, so lots of discounts. I encourage you to, again, get into mycigna.com or the MyCigna app, play around, see what discounts are out there. Most health insurance companies have these things, and they're not used a lot because people don't know they're there. Again, go to mycigna.com, navigate to Healthy Rewards. You can also call them at 800-870-3470 if you have specific questions. I find the easiest thing to do is go to the website or app and play around. The third program that they've built in is called Lifestyle Management. So lifestyle management is going to help you address certain things. So there's a weight management program. Through Cigna Lifestyle Management, you're going to be able to create a healthy living plan that's going to help you be more active and eat healthier. And they're going to help coach you through that. There's a tobacco cessation option. It's going to let you create a quit plan with a realistic quit date. We all know you can't say, I'm quitting tomorrow. It's a process. But they're also going to help you with some over-the-counter nicotine replacement, patches or gums that are going to be free. So if you want to quit, and we encourage everyone to look at this, if you are a tobacco user, if you are a non-tobacco user, you're getting a discount on your health insurance premiums. This is a good way to get that discount in the future. And they're going to help you with some of those supplies. Stress management. We all know stress is a thing right now. There is a program built in through Lifestyle Management that's going to help you figure out where your stress issues are, although I think we all know where our stress is, but also help you manage that. So again, very nice product built in. You pay nothing to access these services. You get there through MyCigna or calling 800-CIGNA-24. So if you want to get into tobacco cessation and you want to just call 800-CIGNA-24, they're going to ask for your ID number, they're going to look you up, and they'll help you get started. And then the last one we want to talk to you about is the Cigna One Guide. We communicated that out a little bit during open enrollment, but it's a program that continues to go on. Basically, it's a service that's going to let you get personalized guidance with things like understanding bills. One of the hardest things about the health system is the way that you get bills and the discounts and the copays and all those things. So they're going to help you there. I want to also point out that my office does this for you guys. So while Cigna is there to help you, if you want to have personal service with that, we can always help with that as far as going through bills and understanding them. One thing that they can do a lot is help you with cost estimates. I met with a gentleman yesterday. He said, I need to go get a sleep study. How much is that going to cost? I've heard numbers. I have rough ideas of what I think things are going to cost, but I don't know. This service, the Cigna One Guide, when you talk to them, you can say, I live in Hendersonville. I need to go get a sleep study. And they're going to give you a good close range on what the cost is going to be. They can also help you find hospitals, healthcare providers in network. If you don't want to play around on the website, you want to talk to somebody, that's fine. They can help you with healthcare issues. So the Cigna One Guide is a great service that's just there for you. Again, mycigna.com, the MyCigna app, or using the phone number 888-806-5042. And over the last several slides, I keep saying mycigna.com, the MyCigna app. Those are important things to have access to because everything that's available to you will be visible to you when you register. So we highly, highly encourage that. So I appreciate your time today. Again, we wanted to just kind of take this first wellness class as a chance to say, what does Cigna have out there for us? And let's do a reminder of, ER versus urgent care versus convenience versus telemedicine and teledoc. I think it's good to remind ourselves over time, drill that into, I have to do it. When I have something going on, my first thought is, do I need to go to the ER? So it's good to remind ourselves of that. So we wanted to take this first wellness session and do that. Again, I'm Mike Dodd. If you guys need anything, my office is here to help you. Let us know. You can email us at info@weshaw.com. The office number is 615-264-2065, or HR knows how to get in touch with us. And I appreciate your time today and look forward to seeing you guys in person in the near future. Thanks.